So this person was the main character in med Twitter recently, which is not something anyone wants. And they said, med student, please know your anatomy before asking to scrub. Please, you can't be calling peritoneum as endometrium during a C-section or fascia as subcutaneous fat. Layers of skin is bread and butter. And there are a lot of normal takes with this that make sense, right? Like, oh, you were just a med student, you're a resident now, you remember what it's like, they have a shelf coming up, let alone knowing anything going on in their life. They could have a family, they could be going through a difficult time because medical school in and of itself is difficult enough. And I think like any time I've made mistakes posting things on Twitter, because a lot of people throughout training do, it's a very emotionally saturating time. We only have so many outlets that we have. I don't think this post is completely out of malice, because, it can be frustrating as a resident sometimes to feel like I'm giving my heart and soul to prepare, and some medical students are just not interested, which is fine. But I feel like posts like this come from an inconsistency in expectations between the student and the resident. If this student is going into, obviously, OB-GYN because we're talking about a C-section, then that could be a problem. If they're a sub-I, they need to prepare. It could be helpful to them to say, hey, here are the expectations. You need to rise to these expectations. But if instead the med student on day one was like, hey, I'm just here so I don't get fined. I want to pass my rotation, of course, but I'm going into psychiatry. Difficult conversations like postpartum anxiety or postpartum depression, fetal loss in a desired pregnancy. Can we maximize opportunities to go through those things? Because that would relate most to people in psychiatry who I might see eventually. These are conversations I have in the ER all the time, which granted is easier for me because it's like, hey, we see everything. What do you care about? Derm? Great. Look at everyone's skin. So I've been a med student who's posted things that I regret, and I've been a resident who's also said things that I regret, so I don't think we need to dunk continuously on this resident. I think they get it. I think a lot of the internet would be a lot kinder if we assumed people didn't post a lot of things from a malice standpoint.